We are answering your coronavirus questions with Cone Health's Chief Pharmacy Officer, Dr. Deanne Brooks. All right, so this question is, if you're from a different state, you're here for a long period of time because you're taking care of a sick family member, can you get a vaccine in Guilford County?
Yes, you can get a vaccine. You can make an appointment and we'll be happy to vaccinate you.
Yeah, I don't think you have to prove whether you're in state or out of state or any of that.
We don't ask for identification.
You don't show your driver's license. That's true.
Right.
So this person says, can you still get a COVID test done if you think you might be showing symptoms? Where do I go?
Yes, you can we still have our testing sites that are available, and you can also now, unlike at the very beginning of this pandemic, you can get tests also at local pharmacies as well.
And much easier than it used to be.
Yes.
This person is asking, are any Cone Health vaccine sites drive-through locations?
We do not have any drive-through locations at this time. At the FEMA mass vaccination site at Four Seasons Mall, there is a drive-through option, and we do not have that at this time.
Okay. In Group 5, do you still have to call and make an appointment?
Yes, you will still have to call and make an appointment because we want to make sure that whenever you arrive, there's not a long line that you're going to have to stand and wait in. So that appointment making is very important.
Yeah, it still runs like clockwork. Even if it's open to everyone, it still is there's still social distancing. There's still protocols that still have to be done.
That's right.
So this person is asking, can COVID-19 symptoms last for 3 months?
So we do have patients that do have long-lasting effects from COVID-19 for as long as 3 months and even longer. And it's part of what we call a post-recovery. And there can be some lingering symptoms that can occur from COVID-19.
All right, this question is, the CDC director warned of impending issues as COVID cases could possibly surge. Do we need to be concerned for yet another spike?
Yes, we do. Absolutely. We could have another wave that is coming, which is why it is so important to continue those 3 W's that we talk about all the time and wearing our masks, because as more things are opening up and those numbers are going down, if we do not have the vigilance that we have had, we will absolutely have another surge in cases.
And this is just a nice thing. They said they wanted to say, my visits to get both my shots at Cone's facility in Burlington were very efficient. It's always good to hear that, isn't it?
Fabulous. It is. We have a great team working on this.
So this person is asking, will there be any point when people will be able to decide which vaccine that they get?
You know, there may be a point once we have plenty of vaccine available, and once we have more vaccine that is being administered in the typical channels that we see for vaccine administration, like we do flu vaccine in our pharmacies and in our primary care provider offices, that may be a possibility in the future.
And this person says, I've had the virus. How long do I have to wait before I get the vaccine?
Yeah, so it depends on a couple of different variables, and we would want to ask some questions. It can be as long as 90 days, but sometimes within 45 days or even shortly after quarantining.
And then this person is asking, if you don't feel side effects after receiving both vaccines, does that mean that the vaccine didn't do its job?
Yeah, that's a great question, and sometimes we worry about that. Oh, I didn't get any side effects, my roommate did get some side effects, and it's just everybody is different the way our bodies work, and it doesn't mean that you are not fully immunized, and just because you did get a big reaction that you're more immunized. Our bodies just work differently and to that immune reaction.
And because we have heard of the side effects of not feeling good afterwards, this person is asking, is it okay to take a pain reliever after getting the COVID vaccine?
Yeah, so that's something that you can read different things about. Will you potentially reduce your immune reaction if you take a pain reliever? And what I would say is, if if you can't get up out of bed and your head is throbbing and you cannot move, you can certainly take a pain reliever to make you feel better.
All right, and just quickly, do we believe a fourth wave of cases is on the horizon, and what would contribute to that?
So again, as I was mentioning before, it is possible, and what contributes to it is the variants. The variants that are out there spread more easily than the original COVID-19 virus, and so that is absolutely a possibility. And again, the importance for us to continue our vigilance with making sure that we are social distancing and wearing our masks.
Well, thank you so much for your time. We appreciate you taking all those text questions. Thank you for sending in those questions. Of course, we will put all of this online, so you'll be able to go back and listen to it, maybe share it with a family member who needs to hear a certain answer to a question.